So the National Consortium for Credentialing Health and Wellness Coaches, sorry, it's a mouthful, got started because a number of us had come together several years ago who were focused on creating a field, a new professional role or profession in healthcare. And we'd all come to the same conclusion that we needed a standard. We needed to set a bar in order to move the field forward, in order to do good research so that we could compare apples to apples, in order to bring credibility to the field, in order to support reimbursement. And so we kind of collided, in different ways, in different places. And I mean, there was one thread which was Dr. Oz and his network that were really interested coming out of a sort of national agenda. There was the integrative medicine field. There were, a number of us with coaching schools on the business end. And we kind of all came together and realized, we all have a common mission, which is to build this field, and we needed a standard. So the consortium came together of thought leaders who were passionate about setting a high standard for the field. And up until that point, we were not collaborators because the way the marketplace works, we were competing. And not that we were vicious or, we're all nice people. But we also kind of realized that collaboration was going to be the answer to move the field forward. And it was at that point, and there were probably a dozen or so people all kind of rallied around that we brought in the early days. And probably the biggest accomplishment that we made in the early years was, and it did take years, was getting us to all agree on there being one coach, one standard covering clinical to consumer. And that we would really confuse the marketplace if we had different standards and different baskets of competencies. So we pulled that all together. And once we had decided that we wanted to build this together, then we of course, we were all volunteers. We had to raise money. We had to create a legal entity. We had to build a website. And so once that was all put together, we were really fairly recently in the last year ready to march forward. And now it's moving at a rapid pace because we created a legal entity, we raised money, we performed the first steps that you do when you want to build a new profession, which is that you get together practicing coaches. And frankly, it had taken years before we had enough practicing coaches in enough areas to create that cadre that could then define the job, define the tasks, figure out the knowledge and skills that are needed. So we're now at the place where we have achieved the first stage, which is we've defined what is a coach and what does a coach do and what skills and knowledge does a coach have to be able to practice this set of tasks. And we're now very close to defining what it takes in terms of training and education and background to get there. And then the next step is to bring the field together to sort of endorse and pressure test and just make sure we've done all the right things. So we're within real shooting distance now of a national credential. The National Consortium, well actually we didn't call it that then. The team of us started together 5 years ago. And I mean, I think our first meetings were probably 5.5 years ago. And so the first stage was team building, and then we built a summit. So the first thing was the core team. Then we created a summit with 70 stakeholders participating, which was an amazing experience because we used an appreciative inquiry process, which led us to this common vision that we really did want to transform the healthcare system and be part of the catalyst for that change. And being coaches, we could see that the way that coaches work and participate in the patient-centered, client-centered agenda, that we could be really pivotal in that experience. And everybody really got that energy. And then from there, the next step was really to define the path to a national credential, and there are lots of different ways to do it. And so we eventually landed on building a nonprofit entity, raising money, and following a best practices process to figure out the tasks, the skills, and knowledge that coaches needed to perform. So we built the legal structure to do that. We created a board of directors. By this point in time, I mean, I'm kind of leaving out the ups and downs along the way, but we were pretty well all coalesced around one agenda. And so we had all moved from being competitors in the marketplace, you know, with, and I'd say friendly competitors. I don't think there were any, there was no hostility or any bad blood in the marketplace, but we're still not, you know, how much do you share with your competitors? How do you collaborate? And so I think the biggest accomplishment was we went from being competitors to having deep friendships and a collaborative agenda. And I think that's actually what's driving us forward now. I think we've all transcended, we've all moved past ego and self-interest and organization, and even personal and financial interest, to say this is for the betterment of the industry. And that energy of collaboration, of serving a larger cause, is the life force now behind this group. So we're well on the way. We're not far off having a national certification. You know, fastest time frame, a year, you know, longer, it could be 2 or 3 years. We can't predict everything that will happen between now and then. But the energy's there, the resources are there, and so we're marching. We're not far from the finish line now. The National Consortium has a mailing list, and so sign up for that and keep up to date with what we're doing. And second, making a donation is the best way to help, to show your support, to help fund the various activities that we're needing to do to drive this forward. So those are the best things that we can do. And I think also be an advocate, you know, through social networking, talk about the value of standards. There are a lot of people that are calling themselves coaches who have not been through any formal training in coaching competencies, and coaching skills are not easy. You know, this is not something you learn in a book. You know, to sit down and be, as I was saying recently, being, you know, the coach facilitates, you know, self-directed neuroplasticity. I mean, we are actually helping people change their brains, and that takes more training, not less. And so we really need you to help us make the case for that in the field and for the betterment of the field. So this is a team effort, and we're hoping that more coaches and more organizations that are supporting coaching will get on board with us and make donations and spread the word, because we are volunteers, and the more shoulders to carry this opportunity and project, the better. And if you're a coach, or you've been a client of a coach, or you're a coach trainer, or you're an organization that employs coach or delivers coaching services, we'd love to have your help, because we'll all be better off. The field will grow and flourish when all of us are together on this mission. So we live in a world where evidence is important when you're offering new interventions and new programs in the healthcare system. So it's very important to be thinking about how we're going to generate the evidence that's going to make the difference. At this point, the evidence is, it used to trickle in, and now it's a bit of a flood. You know, there was a meta-analysis done a year ago, and we've got getting on to 300 studies of health and wellness coaching that would meet the definition of what a coach does, which means we help people find their own way. We help people discover their goals. We help them be more autonomous, more confident, and improve their health and wellness in ways they've not been able to do alone. So now we've got a growing literature base. I'm thinking that we just had a paper out this month from the Global Advances Journal to do with smoking cessation in a hospital in the Midwest, and the results of multiple 40-minute coaching sessions over a few months was something like a 73% quit rate within a month, and at a year we were getting close to 60%, which is a pretty good predictor of long-term smoking cessation. So that's an example of how we can really move the field forward. There are studies, as you would expect, coaching addresses the self-care side, which is applicable to many, many diseases. So we have research that Duke University has done in heart disease and diabetes. We have studies with ADHD, we have studies with cancer survivors, obesity. There are case reports in primary care, in employee wellness, in rehab situations, and I'm involved in a clinical study in fibromyalgia that's going very well. So you're starting to see breadth and depth. Now, the challenge here is that in order to really evaluate the evidence, you really have to have one population that's homogeneous and one protocol. So what we're seeing is an emergence of a lot of data across a lot of different populations with a lot of different protocols. And I think the future, because randomized studies are so difficult to fund and they're often very narrow in terms of the population and the research and the protocol, I think the future is going to be all of us pooling all of our data together and going with this new format that the NIH is supporting, which is practice effectiveness research, where you need tens of thousands of patients, or in our case, coaching clients, obviously across a wide range of settings and a wide range of clinical indications, as they say in medicine, and that when you pull all that together, we're going to see significant improvements. And I think that data set's actually out there, that it's up to us now to pull that data, because people are busy doing the work and not generating data. And I think we need to pull together a team of researchers, and I think we're within a year or two of having enough data to say, this is moving the needle, and this is the minimum standard, and let's get rolling. Let's put this into practice, and then let's, it's one thing to set a standard and set a bar, but that's the start. The group is collaborative, and so over the coming years, we're going to be able to see what worked and what didn't. I mean, there's a paper at this conference around a study that was in your journal, was in the Global Advances Journal, where we had an employee population and we had a heterogeneous population. And the indicator, and not all the data's in, but the indicator shows that there's a statistical significant improvement in blood pressure. And I've seen that in a few places, in a few studies. And so that makes me think that we are leaving aside all the clinical application-specific measures. What are we doing through the relationship, through the promotion of control and efficacy and agency? We're reducing stress. We reduce stress, you bring blood pressure down, and then the natural desire to be well surfaces. And so I often say the thing we need to do most is to bring down the stress levels so that the natural urge to be well will bubble up, and then people will just do the right things and be healthy. So we're on the way. But I think we need to be clear about that standard, and then go out and pull in all the data and get it into the literature, just the way your journal has been doing, through case reports, through more non-traditional ways of showing that this is working in practice. So the National Consortium has a website. That's ncchwc.org, and we have a section on their page called Research, and there we keep it's actually a PowerPoint deck that summarizes all the recent studies that kind of all add up to make the case for the positive outcomes in coaching in terms of improving both medical, hard biometric data, as well as more general well-being measures.